Okay, so we are going to start by going over what the birth of your newborn looks like. And with that, we wanted to let you know what to expect as far as who is going to be in the room when it's time to have your baby.
There's a lot of people in the room when you have your baby.
There could be as little as like 3 staff or as many as 6, 7,
10.
sometimes way more. Yeah. Okay, so you can expect to have your labor nurse, of course. She will be with you throughout the whole labor process. But then you will also have a delivering provider who will be delivering your baby. And then you will have a nurse that is designated just for your baby, so a baby nurse. And then if there are any complications, either throughout the labor or throughout your pregnancy, then they might ask the NICU or the neonatal intensive care unit personnel to come in. And that could be just a NICU nurse, or it could be a NICU nurse, a NICU respiratory therapist, and maybe even a NICU provider as well.
Yeah, and sometimes risk factors come up during labor that they might want to bring in a couple of those extra NICU people just in case. So it doesn't always mean that something is going to happen. We just always like to be prepared.
If NICU personnel are asked to come into the delivery room when you are having your baby, they typically will just stand over by the panda bed and we'll just hang out there. And if they are not needed, then they will just leave. And if your baby needs them for any reason, then they will take your baby over to the bed to assess them.
Yeah, and so when your baby comes out for a vaginal birth, then typically what they'll do is they'll place a towel over your abdomen and they'll place the baby right onto that, because the baby will still be connected to the umbilical cord, which is connected to the placenta. So sometimes that's a short cord, sometimes it's a little bit of a longer cord, sometimes the baby bungee jumps. No, they shouldn't be bungee jumping, not until they're older. But when they place them on that towel, they usually dry them off and make sure that they look good, they're breathing, they're crying. They might look a little blue, they might look a little slimy, all that's good. And what we typically do now is delayed cord clamping. So ACOG, which is the American College of Obstetricians and Gynecologists, do recommend 30 to 60 seconds of delayed cord clamping. So most hospitals follow that, and typically about a minute. They'll leave the cord attached before they clamp. So they put 2 clamps on, and then they ask whoever, it might be you, your support person, whoever you'd like to do that, to cut the cord. And at that point, they're able to lift the baby all the way up onto your chest if you're doing skin to skin, or if you'd like your baby swaddled, or however you'd like the next few minutes to go, then you can just let them know that ahead of time so that they can do that for you.
Yeah, and along with that, something good to think about ahead of time is who you want to cut the cord when it comes time to clamp and cut the cord. It could be you, it could be your partner, your support person, or it could just be the delivery provider if you guys don't care or have any desire to cut it. Just know it will be pretty tough to cut. It doesn't look as hard to cut.
They come in a variety of thicknesses, and yeah, they have a little gelatinous girth to them.
But it's not just like a snip, it's like a for some of them.
So just cut exactly where the doctor tells you to cut. Don't cut anywhere else. Sorry.
Don't get too carried away with scissors.
Yeah, the next thing, is that skin to skin. Skin to skin is really great at helping your baby stabilize after birth and making them adjust to life outside of the womb. So there's a lot going on, and they're gonna feel real comfy and cozy if they're up by your chest. If skin to skin's not your jam, you can ask that they are swaddled up so that they stay nice and warm. And yeah, it's a great time for bonding. It's a great time if your wishes are to breastfeed. It's a great time to try breastfeeding after your baby calms down. Usually takes them about 20 minutes to kind of calm down, and then they start looking around for food, and that's when you might have your first breastfeed. So
yeah. Something else that we forgot to mention is when the baby comes out and they are still attached to the umbilical cord and the placenta, oftentimes you'll see the nurse kind of vigorously rubbing them with a towel, and that is going to just make sure that they can stimulate the baby. They're assessing the baby at the same time, making sure your baby is breathing okay, pinking up okay, things like that.
Yeah, take their first breath. They come out, they look pretty blue, and in that first 10 minutes, they should pink up. And so crying really helps with that. Not all babies cry right at birth, and I know that can be kind of a little bit strange if your baby doesn't have that big first cry, and that can be okay too. So that's why you've got your team there to make sure that your baby's looking good. They might listen with the stethoscope while the baby's still on you. And most of those assessments, as long as your baby's doing okay, a lot of those first couple assessments they can do while your baby is skin to skin or swaddled with you. So the best thing, we call it the golden hour, is that they just stay with you for that whole first hour. They get that first feeding, however you're feeding your baby, before they take the baby over to do their medications and do their assessment and weigh. So it's really nice if you can have that first hour just to help your baby stabilize. It helps their vital signs stabilize, blood sugar, temperature, just relax. So
yeah. And if your baby comes out not looking right, or even if your baby comes out crying and pinking up and looking just fine and kind of starts to decline a little bit in the first couple of minutes, at any point, just know that your baby is being monitored fairly closely, especially for that first 10 minutes or so, and then a little less for the next 2 hours, and then less, even less after 2 hours, or after the 2 hour mark. But if your baby needs to be, like if the baby's born and there's any concerns at all, they will go ahead and clamp and cut the cord right away rather than waiting for delayed cord clamping, and take it over to the Panda bed, either to be assessed by the baby nurse or NICU personnel if they are in the room, or even if they call them to the room. So yeah.
Right. And that's why they bring in another nurse that's just dedicated to your baby in that moment, so that, there's no distractions. That nurse is there to be watching your baby and make sure that your baby's okay, and if not, to intervene so that everything is good.
Yeah. And if they need to do any resuscitation at all, or even just monitor your baby's heart rate or oxygen levels or anything like that, that is something that the lovely Panda bed will be able to do. Yeah. They could administer oxygen.
It's like the cost of a Cadillac. It can do it all.
Might even make your next baby for you.
Yeah, this thing can do everything. It can give oxygen, it can give suction, it can do weights and measurements, it can give heat. It's got a little heat lamp above. What else? It's got a monitor on it. It can watch your baby's heart rate and oxygenation, and it has all the supplies in it. And they can even wheel it out of the room if they need to take your baby to the NICU for any reason. So it's portable, it's convenient. And it's not scary at all because it's just there at every delivery just in case. So if you see it, do not freak out. It is there just in case, and as soon as things wind down, they'll be getting it out of there.
Right. Yeah.
All right. If you got something valuable out of that video, please remember to hit that subscribe button, give us a like, and share this with a friend or family member so that we can keep sharing our nursing experiences with you. Thank you.